Imagine, if you will, a incredibly potent, highly volatile chemical compound, a substance that is literally so ubiquitous it covers the globe, yet it's so powerful it operates as the ultimate solvent, completely driving the gears of the human machine. Today, I'm going to act as your clinical guide, maybe with just a touch of a Victorian apothecary introducing some life-altering potion to walk you through the astonishing clinical pharmacology of dihydrogen monoxide. It's a substance you almost certainly interact with every single day, but as our sources reveal, it absolutely demands your respect. 6 liters. I want to hook you immediately with what happens when this compound is misused. According to documented clinical warnings and pediatric risk data, 6 liters is the exact amount of this compound given to children in some truly tragic forced ingestion cases. And the result? Rapid onset of seizures, severe vomiting, hypoxemia, and deep coma. It is a stark, terrifying reminder that the dosage makes the poison. And man, this substance is absolutely no exception. So consider this our clinical prescribing manifest for today's session. We'll cover Section 1, Dihydrogen monoxide and introduction. Section 2, Prescribing the proper dose. Section 3, The threat of overdose. Section 4, Contaminants and hidden perils. Section 5, Dangerous drug interactions. And finally, Section 6, Respecting the ultimate solvent. All right, Section 1, Dihydrogen monoxide and introduction. Dihydrogen monoxide, which you probably just know as water, or H2O, is the principal solvent of your body. It makes up roughly 50 to 60% of your adult body mass, and actually up to 75% for a newborn. Now, when it's prescribed properly, its benefits sound basically like a late-night infomercial for human health. Randomized controlled trials show it maintains plasma osmolality and circulatory volume. It's a proven mood enhancer and cognitive booster. In fact, roughly 1,000 milliliters has been identified as an optimal single dose to improve processing speed and working memory. It even acts as a headache prophylaxis. One trial showed that simply increasing your daily intake by 0.8 liters reduced reoccurrence headache frequency. But as we're about to see, these benefits sit on a razor's edge. Which brings us to Section 2, Prescribing the proper dose. This brilliantly illustrates the terrifyingly narrow safe operating window for human biology. The U.S. Institute of Medicine sets an adequate intake at around 3.7 liters a day for men and 2.7 for women. If your intake is deficient, you're facing hypovolemic shock, acute kidney injury, cognitive impairment, and kidney stones. But on the flip side, excess intake leads to confusion, seizures, cerebral edema, which is brain swelling, coma, and death. You are constantly walking a biological tightrope between dehydration and outright intoxication. Now let's get into Section 3, the threat of overdose.
I really want to pose this directly to you. Can you actually overdose on water? We're constantly told to hydrate, to drink more, carry a giant water bottle everywhere, right? But the clinical pharmacology of water states unequivocally that yes, an acute ingestion that markedly exceeds your renal free water clearance, which is roughly more than 0.8 to 1 liter per hour sustained, can absolutely be fatal.
The crucial point here is this condition, dilutional hypernatremia. You might have heard it called water intoxication. When your ingestion outpaces your kidney's ability to actually excrete the water, this everyday solvent turns incredibly toxic. It dangerously lowers your serum sodium levels. The source material literally highlights this as a boxed concern. So who's at risk? Well, endurance athletes and military trainees who drink excessive fluids to prevent heat injury, which has tragically resulted in deaths, including an Army basic trainee. It also heavily impacts psychiatric patients with conditions like schizophrenia or postpartum psychosis, who sometimes develop compulsive water drinking behaviors, which is clinically known as psychogenic polydipsia. Now think about this specific metric. Normal serum sodium is much higher, but when a patient's level drops below 120 millimoles per liter, the clinical literature documents irreversible brain damage and sudden death. In fact, deliberate massive ingestion has even been used as a means of suicide. One recent forensic autopsy confirmed severe hyponatremia at a staggering 113 millimoles per liter, and that was accompanied by massive fluid overload and diffuse cerebral edema. Let's actually break down the mechanical, gear-driven pathophysiology here. How does water brutally break the brain? Step 1, you rapidly ingest water, which severely dilutes your extracellular sodium. Step 2, because of the osmotic gradient, all that excess free water aggressively shifts into your cells. Step 3, and this is particularly devastating in the brain. Brain cells swell, but they're trapped inside a rigid skull, producing cerebral edema. This swelling causes catastrophic neurological symptoms: headache, confusion, seizures, coma, and ultimately death. Moving right along to Section 4, Contaminants and Hidden Perils. Think of this as the apothecary's warning label. The hidden perils of hydration are vast. If untreated, this liquid can harbor microbial pathogens like Cryptosporidium and E. coli, parasites, and nasty viruses. It carries chemical and radiological toxins, think lead, arsenic, and PFAS. It hides microplastics. Even just mechanically, upon swallowing, it represents a severe tracheal choking hazard. If it happens to enter the wrong pathway, it becomes a transient nasal irritant. And honestly, simply consuming it at the wrong temperature can trigger a debilitating cold water headache. The environmental dangers are literally ever present. Next up is Section 5, Dangerous Drug Interactions.
Combining high water intake with D-specific drugs creates a deadly biological trap. First up, desmopressin and antidiuretics. If you take these and drink excessive free water, your risk of seizures and severe hyponatremia skyrockets. Our sources actually note a case of a patient having a seizure right before a colonoscopy due to this exact combination. Thiazide diuretics impair your ability to excrete free water, directly adding to the hyponatremia risk. Then look at MDMA and amphetamines. They independently stop your body from excreting water by releasing antidiuretic hormones while simultaneously massively increasing your thirst. It's a complete recipe for severe water intoxication. Finally, lithium. If your water intake constantly fluctuates, it alters how your kidneys clear the lithium, and that can quickly lead to lithium toxicity.
Oh, and here's a really critical warning for standard administration. Certain drugs absolutely require plain, unfortified dihydrogen monoxide. Medications like oral bisphosphonates for bone loss, levothyroxine, and certain antibiotics like tetracyclines must be taken with plain water. If you use mineral-fortified waters containing calcium or magnesium, those minerals actually block the absorption of the drug. And finally, Section 6, respecting the ultimate solvent. I want to deliver this warning with the absolute medical gravity it deserves. There is no ambulatory home management for symptomatic overdose. Emergency care should be sought. If someone suffers from acute water intoxication, you cannot treat it at home. It requires immediate hospital-based fluid restriction. Medical professionals have to carefully, and I mean very gradually, correct the serum sodium levels, often using hypertonic saline, because if they correct the sodium too quickly, it causes a catastrophic condition called osmotic demyelination syndrome, which literally strips the protective coating off the brain's nerves. So, we've covered a massive amount of clinical pharmacology today. We've seen the razor-thin window between life-saving hydration and fatal cerebral edema. We've explored the deadly drug interactions and all those hidden contaminants. So I'll just leave you with this question. Knowing the precise clinical risks, the contraindications, and the potentially deadly side effects of an overdose, will you ever look at a simple glass of dihydrogen monoxide the same way again? Thank you so much for joining me on this explainer, and hey, stay safe out there.